Capitol Report is a production of Senate Media Services.
On this week's program, one lawmaker makes the case for health insurance coverage for infertility treatment, and another talks about new worker protections and benefits enacted in the last legislative session. Plus, it's almost time for the state fair. Stay tuned for this week's Capitol Report. Welcome to this week's program. I'm Shannon. According to the Kaiser Family Foundation, a nonprofit organization that focuses on health policy, an estimated 10% of people need fertility assistance to have a child. Senator Erin McEwen is the author of a bill that would require that Minnesota insurance companies include coverage for infertility treatments in their health plan offerings. She joins me now in the studio. Thank you for being here.
Thanks for having me.
There are a number of reasons why people may seek fertility treatment. In vitro fertilization, or IVF, is probably the most commonly recognized treatment, but the subject area is actually broader than that. What are some other reasons that people seek fertility treatment?
That's a really great question. So some people seek fertility treatment because they can't have a child through P and V, as we call it, penis and vagina sex. Sometimes they do it because they want to be a single parent by choice. Sometimes because of past illness like cancer and they've had to use fertility preservation. Sometimes because of genetic disorders, and so they have to go through the IVF process to pre-test embryos to make sure they're not passing on things that could be life-threatening or life-ending for their future children. And so there are so many reasons why people use fertility services, and we wanted to be sure in this bill that it covers all of those reasons.
In March, Axios Twin Cities put together a list of some of Minnesota's biggest companies and the fertility benefits that they offer. So, for example, Best Buy supports adoption and surrogacy-related expenses, offers $10,000 for fertility treatment services, and up to $5,000 for pharmacy costs. Blue Cross Blue Shield Minnesota offers a $25,000 maximum for fertilization and cryopreservation, which is freezing eggs or sperm. But there is no standard, and many other insurance companies offer little or no coverage. Is establishing a standard for coverage part of the intent of this bill?
It is, and we want to be sure that every person, these large corporations have recognized what we know here at the legislature, which is every person should be able to start or grow their family, regardless of their income, their race, their gender, their zip code, their relationship status. And so we want to be sure that every person has this available to them, and it's not just a perk of a job that you have.
Some states already require health insurers to cover some costs, but significant gaps in coverage remain. In fact, for many, fertility care is often inaccessible due to cost, or people are simply going into debt in order to start a family. If your bill becomes law, would starting a family become an affordable option for everyone, including people on medical assistance?
Absolutely. This bill explicitly includes people who are on public or private insurance because we don't want to create those inequities through our laws that already exist in the insurance system. We want to be sure that every person has the right to have a child if they want to become a parent.
Now, in your bill, is it a limited benefit, like a certain number of treatments or a certain cash allowance? I know that this may change as the bill moves forward, but in general, is there a level where the coverage does stop?
No, but that's because usually there is a level to which people will stop, and we don't want to put an artificial limit on what people can choose to go through. It is a very arduous process to go through IVF, to go through IUI, to go through fertility preservation, and so there are limits that both providers, doctors, and people have, and we didn't want to say this is the blanket limit for every person because it's going to differ from person to person, family to family, issue to issue, reason to reason.
The Kaiser Health document that I referenced in the introduction states, quote, fewer Black and Hispanic women report ever having used medical services to become pregnant than white women. This is a result of many factors, including lower incomes on average, as well as barriers and misconceptions that may dissuade women from seeking fertility assistance, end quote. So is this also an equity issue in your view?
It absolutely is an equity issue. We listed some of the wonderful companies who are providing this assistance through their benefits program, but we know that these benefits do not trickle down into the jobs that people with lower incomes typically have, people who are Black and Hispanic and Asian and Latina typically have, people who are single, LGBTQ people. This absolutely is an equity issue, and we know that if money is the way that people are currently accessing fertility services, then it's people with money or people who have access access to people with money that are able to do it. And that's going to typically leave out people who are lower income, people of color, LGBTQ people, people who have gone through serious medical issues, people who live in rural areas. And so we want to be sure that we are not creating those inequities in our bill and covering every person.
So fertility treatments can be quite costly. Is mandating coverage likely to raise rates for everybody?
That is a great question, and the answer is no. And there's a few reasons for that. One, it is costly to go through fertility services as an individual, but it's not costly if you spread that across an insurance pool. The number of people who are of a reproductive age and who want to be parents is quite small when you talk about the actual population in the state of Minnesota. And so, you spread that across, an insurance pool, and we don't see rates go up. A cost for fertility services could run anywhere from $10,000 to $50,000. That could be an appendectomy, an MRI, or an X-ray, right? So we're really talking about a cost that often the insurance pool bears, but that individuals often don't, right? We're not often paying for our own MRI. So we've seen in other states that insurance rates have not gone up, and that is the really good news. We're actually pairing fertility coverage in this bill with prenatal and maternal health care. And that's where we find that parity, is we're just putting it all together and covering it in the same way.
The Star Tribune reported recently on couples who have maxed their credit cards or taken out a second mortgage on their home in order to start a family. If this bill becomes law, then they would be helped, but so would a single person, as you've said, or a same-sex couple who want to start a family. In essence, with this bill, is it stipulating that there is a right to family formation regardless of a relationship status or a person's gender?
Absolutely. I've talked before on this program about how I'm a reproductive justice advocate, reproductive justice being a framework that was created by Black women in the 90s. And there are 4 primary principles. The first one is the right to have a child. And in this country and in our state, if you can't actually afford to start your family, then you don't actually have the right to have that child. And so we are creating laws around that first principle of the right to have a child. We want Minnesota to be the best state to have a child, raise a child, and raise your family, but it starts with people being able to actually have those children.
And so in what you just said then, is that how you would argue then that it is in the state's interest to make sure that anyone who wants to start a family can?
Absolutely. We want parents, or people who want to be parents, to be able to become parents. We want people to enjoy parenthood and be able to experience that. We don't want to force people to become parents, but we want people who want to become parents to be able to. And cost, quite honestly, is getting in the way for a lot of folks, and we want to remove that barrier and make Minnesota just a great place for all families.
Senator Erin McEwen, it has been a pleasure. Thank you.
Thank you so much.
Each year, state fairgoers are asked to take an opinion poll on pressing state issues. Questions are developed from among the numerous bills proposed by lawmakers and represent pressing issues and concerns that remain unresolved. You'll find the Minnesota Senate booth and the House of Representatives booth inside the Education Building on Cosgrove Street at the State Fairgrounds. In addition to making your views known by taking the separate polls offered by the Senate and the House, you may have the opportunity to visit with one or more lawmakers frequently on hand to listen to the concerns of fairgoers. The Education Building also houses booths of some of Minnesota's nonprofit and educational institutions, offers robotics demonstrations by middle and high school students, and displays art, writing, and craft projects demonstrating the work of some of Minnesota's most talented kids. If you happen to find yourself at the Great Minnesota Get-Together this summer, don't forget to stop by the Minnesota Senate booth in the Education Building to provide your perspective on this year's State Fair opinion poll. Prior to passage of the labor bill by the Senate, Senator Jennifer McEwen, chair of the Senate Labor Committee, praised what she called a beautiful, glorious 275-page bill that aims to improve the lives of a broad spectrum of workers. She joins me now to talk about some of the provisions in the new law. Thanks for joining me.
Thank you very much for having me.
So, Some aspects of the bill have already gone into effect, some will soon, and yet others, like paid sick leave, will take effect on January 1st of next year. Duluth, St. Paul, and Minneapolis already require what's called earned sick and safe time, which allows workers in those cities to accrue paid leave over time, I think 30 hours of work for 1 hour of leave. Why was now the time to make this a statewide benefit?
Well, thanks for that question. I think that the reason why now is the time to make this a statewide benefit is that the same reason that we put many of these provisions into this comprehensive labor package, which is that all workers, whether they live in the metro or Duluth or our metro centers, or they live in other areas of the state, deserve to have this very basic benefit. This means that you will be able to take time off that is paid from work when you are sick. It's just very, very basic stuff. And it's unfortunate that we didn't do this years ago, frankly, in Minnesota, a state that prides itself on workers' rights and protections. To not have this apply to every single worker in the state was a problem and a mistake. So we're really, along with a lot of other provisions in this bill, correcting and bringing things up to date, where I think probably some people assumed they already had this right or they should have this right. And as we know, it varies from profession to profession as well. So people working in certain professions have had that benefit and have been able to count on that benefit largely through the organizing of organized labor over years to make that the expectation. But as we know, many workers in our society, especially those with jobs that are lower paid with less benefits, haven't been able to count on that. And those jobs are sort of notorious for having high turnover and workers that are not paid in a way and don't receive the kind of benefits that they would need to support themselves and their families. And that has to change. So that's one fundamental piece toward making that change.
The new law creates an ergonomics program within the Department of Labor and Industry that will modernize how the state approaches the types of musculoskeletal injuries that occur in workplaces like healthcare facilities, warehouses, and meatpacking sites. What is the goal of this?
Well, we're very excited about these changes to the ergonomics program, and I think the Department of Labor and Industry is really excited to gear up on this. And we heard testimony in our Labor Committee over the course of the session from a number of different workers talking about the kinds of injuries that they're facing now. And I think it goes to, again, the changing nature of work over decades. We have a lot of people working service sector jobs or working in healthcare, doing the types of jobs where they may not be receiving the types of injuries that people who are doing some of the hard labor in manufacturing plants or the mines or different professions where we've already been cued into those types of injuries and what they mean. But these workers matter too, and their injuries matter too. They matter to them, they matter to their families, and making sure that those workers are protected is, again, part of adjusting our laws and our policy to account for the reality of today in the workplace.
Along those lines, the new law also establishes a Safe Workplaces for Meat and Poultry Processing Workers Act, which will give workers the right to refuse work under dangerous conditions while ensuring that they are still paid and that they are not retaliated against. It also requires annual training and establishes a workers' rights coordinator. What is the intent then?
To protect these workers. This is some of the most dangerous work in our economy, is the processing of meats, poultry and meats, and really making sure that those workers who are doing some of that most dangerous work are taken care of is, again, just a fundamental piece that frankly should have been in place already. And a lot of those workers are also migrant workers, a certain percentage of them, and they are, as such, very vulnerable. Some of them in having language barriers, having barriers with documentation or paperwork. They need these protections, and we saw over the course of the pandemic as well, those workers really took a hit for our entire economy to keep us going. And so just these basic protections to make sure that they will be protected physically and economically in their work it's just fundamental.
Warehouse workers will also have expanded workplace protections beginning on August 1st. Employees will now be given a written description of a work quota, and the law stipulates that those quotas must not interfere with necessary break times. Workers will also be able to request a detailed report about their performance. Why are these changes necessary?
We heard, again, testimony in the Senate Labor Committee this year from some of these warehouse workers about the conditions that they're working under. And I think for people who haven't worked in a warehouse like this, we may not quite understand until we hear that detailed testimony of what this is like. They reported to us really being treated like cogs in a machine, literally being treated in this way, that they're not living, breathing human beings in need of breaks, in need of a sense of knowing what is being expected of them. So they reported instances of changing expectations over the course of a shift, not knowing what expectation they were being required to meet. So never really truly knowing, always sort of on the edge of knowing if they're performing adequately, if they're meeting the quota that they need to meet, because it could change, in fact, during their shift, and then they could be retaliated against or punished in some way for not meeting that quota that they didn't even know existed or what it was. So these very simple pieces of legislation of just providing basic information to workers, to people, the people doing these jobs, these basic jobs in our economy, about what's expected of them and what they should know these things. These are very basic things about, and we heard that repeatedly in our committee. This was a repeated theme of people being treated like machines, like they are not actually living, breathing people. And so these laws and these policies in place are designed to say, hold up here, you need to treat these people with respect.
Another new provision is a Nursing Home Workforce Standards Board, which will establish minimum standards in nursing homes, including wages and training standards. Is this an effort to professionalize the nursing home workforce and perhaps make this field more attractive to workers?
I hope so, and especially in regard to the high turnover that we see in this field. We hear it from the people who are running our nursing homes and our care facilities about their struggles in terms of being able to pay the kind of wages that people should expect to be paid, living wages, and then their struggles with maintaining an adequate workforce. So a lot of this provision goes toward is boosting up workforce in this area, allowing people to be able to stay in these jobs, to have some agency over their working conditions and their pay, to be able to organize around these things, and really boosting up that area as a whole.
And then one more question before we go. According to the Pew Research Center, the share of U.S. workers who belong to a union has fallen since 1983, when 20% of workers were union members. Last year, only 10% of workers belonged to a union. That may be changing as news outlets continually report about different groups seeking to unionize. A law change in Minnesota is now that so-called captive audience meetings are banned, meaning that employers cannot require their employees to attend meetings about unionization or to deter unionization or to talk about politics or religion. So what does this mean for workers?
Well, it's interesting that you started with a number from the 80s, because previous to the 80s, that number was much higher than 20%. In the heyday of the middle class and the creation of the middle class of our country, unionization was very commonplace. And I think we need to go back and just take a look at what unionization is. What it is workers being able to organize themselves together in a workplace so that they can bargain collectively together. They can come together, they can decide what they want changed in their workplace or want to be better, and then they can go as a group to have that discussion with their employer together in solidarity, so that the employer has to listen to them because they're organized together as a group. It's not just individual employees trying to bargain with the employer. It's together they are doing that so that they have more power and more of an ability to have their demands met. That's all unionization is. It's very, very simple. It's a very simple human rights imperative that people should have. And so I think that, as we have seen the decline of unionization, we have also seen an increase in wealth disparity in our country overall. It's a huge problem. It is terribly destabilizing for our economy, for our politics. And I think we've seen the fruits of that over these recent decades, where we have an entire class of people in the United States and in Minnesota who are terribly underpaid, working 2 to 3 jobs, not being treated with respect in their work, not being shown dignity in their work. And it doesn't have to be that way. One job should be enough to support a family. It should be enough to support yourself, to be able to go on vacations, to enjoy life, to seek other pursuits. But our economy, our capitalist-driven economy, has been working and grinding people down to the point where I think some people have forgotten what unionization could mean, but the newer generations coming up are looking back and are seeing that promise of what solidarity and union organizing could mean for their lives. And so we are seeing this invigoration of unionization across the country and in Minnesota, and I'm very hopeful for that.
Senator Jennifer McEwen, thank you so much for taking the time.
Thank you very much for having me.
The chamber for the House of Representatives is the largest room in the Minnesota Capitol, and it has many unique features. Brian Pease tells us more. We're here in the House chamber, the largest chamber in the Minnesota State Capitol. It accommodates all 134 representatives, as well as joint sessions like the governor's state address. There are many unique features to this space, but I'd like to start with Minnesota, the spirit of government, which is the statuary above the speaker's desk. I understand it's not original. What's the story?
Yeah, if you were here in 1905 and sitting in the gallery seats where we are, right above us here, you probably would have had people looking back at you, because that whole archway was open with about just over 200 gallery seats. So it was public gallery viewing space to watch the House in session. And then, as it is the case in most capitals, government expands, staffing needs are greater, and so they need more office spaces. So they took out the gallery seats and put another floor of 2 floors of office space for the House staff to work there. So then that gave them a reason to decorate that front wall, because now you have this big space that needs some decoration. So they created a statue done by St. Paul plasterers and artists Carlo and Amerigo Brioschi, and they wanted to represent the spirit of government. That's the figure at the topmost, the female figure with the star, so she's Minnesota. And so you have dates of 1849, 1858 inscribed in the book that she holds open. And then there's also, because we were part of the Louisiana Purchase in 1803, everything west of the Mississippi River was part of that purchase. And so the artist wanted to commemorate the role of Lewis and Clark in our pre-state history. So the woman who was seated, the American Indian woman, is Sacagawea, who was a guide who led Lewis and Clark. The other Native American man is just a person they would have encountered or would have helped them on the expedition. And then on the far right are not Lewis and Clark, but it's French explorers and voyageurs who were the first Europeans who came into Minnesota. So what they were doing is they were making that connection to the existing stencil work that you have in the ceiling, where you have names of Hennepin, Duluth, LaSalle, Perot, who were also those same contemporary French explorers and fur traders that were here.
So it's honoring the entire history of the state, even pre-statehood.
Right. Yeah, and that's the connection. It's going back to the 1680s up to the 1800s, and then eventual statehood.
Behind the speaker's desk is a portrait of Abraham Lincoln. First, why is there a portrait of Abraham Lincoln? It wasn't part of the original design, and also there's a story about how this is not an original, it's a copy. Can you talk about that?
Sure. This was an image of Abraham Lincoln from a painting called The Peacemakers, done by George Healy. And he did a couple of other paintings because that was kind of the representational figure of that piece was Abraham Lincoln. And so he wanted to go to a competition in Europe, made a copy for that exposition or that competition, and then gave copies to Elihu Washburn, who was a friend of Lincoln's from Illinois, and also one to Robert Lincoln, his son. So William Washburn, who was a brother of Elihu Washburn, acquired the painting from his brother. And then when this building was opened, the family, William Washburn's family, wanted to put that on display here. So now we had that painting on display for several decades. Well, then they wanted it back. And so it had become such an important part of the decoration of this building, of this room. So in 1937, they had Edward Brewer, a local artist, make a copy of the original painting, and that's what we have here. So it's a reproduction of the original. And then eventually that original painting that was here for those 20-some years is now in the National Portrait Gallery in the Smithsonian.
And I also understand that this depiction of Lincoln, his son, Robert Todd Lincoln, felt that this was the best representation of his father.
It was, yeah. And eventually the painting that he was given by George Healy, the artist, ended up in the White House. So
it's in the White House dining room.
It's in the White House dining room above the fireplace, yeah.
Let's talk about the Speaker's chair, which was designed by Cass Gilbert, fell into disrepair, came back. What's the significance of it?
Yeah, it's what was designed for this space for the Speaker of the House to have, and it's a very ornamental, very important seat because it has a star with L'Etoile Lenore, the state motto inscribed in the back and the top of that chair. And like all the furniture in the building, we still have a lot of the historical original furniture in the building, but people, didn't always treat the furniture as well as they should. This one actually was in pretty good shape, and so it just once again kind of was out of date. The swivel things were broken on it, and then when this chamber was restored in 1989, then we brought that chair back, had it restored, and has been back in the chamber since that time.
Another element of the restoration was that the clock that was original to the chamber was found in a closet wrapped in newspaper, and now it's back resting where it belongs. But why was it hidden, and how was it found?
Yeah, it was something that I think, you had to wind it every day, so it was a maintenance issue. It seemed to be working fine when they unboxed it, and so there had to be some updates and some fixing to make it electrified. But really that was an important part of the original design. Each chamber has a big marble face clock, and so that was from the House chamber taken down. They just had a regular clock you could plug in, and then when this was discovered, it was like, let's put it back because that's where it belongs.
Let's talk about the ceiling, the very, very beautiful ceiling. I understand it was done by Elmer Garnsey. What are some of the symbols and important things to note about the ceiling?
Yeah, once again, it's an arabesque. So if you walk throughout the entire state capitol, you'll see these beautiful motifs that represent symbols of kind of ancient Rome, but also the Renaissance period, where you have festoons of products and things of Minnesota that are represented in the artwork, and that's the same thing you see here. You see a lot of M's for Minnesota. You see these elaborate motifs woven together that talk about the products of the state of Minnesota.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Lurkey, and on behalf of all of us at Senate Media Services, thanks for watching.